Hi everyone, these are the important questions. Do I need to go for chemotherapy? How many sessions of chemotherapy do I need? What about immunotherapy? What about surgery? What about CT scans? Well, join us on our Simply Healed program every Thursday nights at 7:30 p.m. Singapore, Hong Kong, and Philippine time. Our sessions are interactive, featuring a live Q&A with experts and doctors who will answer your questions in real time. You can type in your questions and get immediate, personalized responses. This is your chance to take control of your health. So take advantage of this informative and supportive experience. Visit our Facebook page and message us on Messenger to find out more. See you there this Thursday. Hi everyone, Shyan here. I'm very excited to announce our very first face-to-face in-person meeting for 2025. Freedom from Cancer, we will be exploring the latest strategies on fighting cancer, and there will be a live panel with the leading experts. You're gonna have exclusive access to get straight answers to your cancer questions. On the panel will be myself to answer any questions you may have about the Simply Nature PPARS protocol. We have Dr. Jimmy Katapia, one of the top surgeons in Metro Manila, who will answer all your questions about surgery. Last but certainly not least is Dr. Jansen and the top specialist in supporting cancer treatments. All three of us will be there answering your questions together. So no more confusion, no more conflicting answers. You will get clarity on June 7th, Saturday, 8 a.m. to 11 a.m. SMX Aura. And also there will be cancer survivors who will be there to share their story and how they succeeded in fighting cancer. So once again, see you all June 7th, SMX Aura, 8 a.m.
Yung sister ko had the symptoms of diabetes. Siguro 10 years na. Madalas siyang umiihi, tapos laging pagod, pumayat, mataas ang BP, tapos siyempre mga non-healing wound.
Yung sa paa po ni ma'am, paano po yun nag-start?
Okay. Kasi ganito yun eh. Yung first na hospital niya, not because of diabetes. Ang una niya, pneumonia. Ayan. Doon nalaman na may diabetes din siya, by accident. Right foot niya, may para siyang matang isda lang. Yung maliit na itim lang. Tapos napapaligiran lang siya ng parang dilaw na kulay na dilaw. Ring sa sugat na yun sa center. Tapos tinanong ko, bakit? Hindi niya daw alam anong reason. So sigurado ko dahil nga may background ako sa medical, siguro dahil yun ay lumala na yung taas ng sugar niya, hindi niya na monitor, hindi niya nabibigyan ng gamot, nagkaroon siguro siya ng komplikasyon. Yung nerve sa paa na damage na. So hindi niya na nararamdaman na may natapakan pala siya. So probably yun siguro yung nangyari. May natapakan siya, nasugat yung paa niya, malit lang, tapos hindi niya naramdaman. Lumala. So, nagkaroon siya ng lagnat on and off, nakahiga lang siya. So, sabi ko sa kanya, so anong plano mo? Sabi ko, pa-check na natin yan. So, pina-check namin as OPD. Chinek, binigyan, niresetahan ng gamot, tapos tinignan yung sugat, binusbos. Pero kapiranggot lang ang tinignan. Tapos, in-advise na lang kami, linis, at 7 days na gamutan ng antibiotic. After na 7 days, lumala lalo. Yung pinaka-pamamaga niya, lumaki lalo. So, sabi ko, ay, na-infect na to. Nilala ko sa emergency room. Ayun, doon nalaman lahat. Mababa pala hemoglobin, mataas masyado yung sugar, yung diabetes niya, talagang, marami ng komplikasyon.
Ano po yung plans ng doktor niya?
Na-refer siya sa ortho. Ang plano sa kanya ay putulin. VKA or the below the knee amputation. Hesitant din kami pumirma ng consent. Then later on, ni-refer naman siya sa plastic surgeon. Nagsabi naman sa amin na maganda pa circulation. Might as well na tulungan na lang natin yung paa, linisin, wound dressing for twice a day, then debridement as needed, religiously. So, yun ginawa namin. Twice a day kami naglilinis, tulungan kami ng husband niya. Hanggang ang nangyari, gumanda, pero andun pa rin yung andun pa rin yung plan na putulin. Hanggang makita na gumaganda na, ayun, hindi na naulit yung plan nila na maputol yung paa.
Kasabay po ba nun may mga tinitake pa siyang gamot?
Bukod doon sa antibiotics, bukod sa mga gamot na binigay ng doktor sa ospital, may tinake din siya na alternative medicine, yung PPARS. May kamahalan. So, sinugal ko para, kasi kailangan kung hindi mo isusugal yun, baka maputulan talaga. Kasi kahit naglilinis kami ng paa, tapos nagdidibri, pero parang slow yung healing process niya. So, I tried na painumin siya at 10 tablets at AM and 10 at lunch and then 10 at the evening. And the soft gel, twice a day also. So, religiously binibigay ko yun sa kanya. Dati kasi dahil nag-peak yung WBC niya, medyo nag-septic siya. Sa mga nakakaalam, sabihin yung infection kumalat na sa buong katawan. Kaya nagkaroon ng problema yung kaisipan na nawala sa wisyo. Dramatically, yun yung maganda doon. Dramatically, after 1 to 2 days, parang nakita ko siya ng improvement. Doon, nakita namin na sa help ng antibiotic and together with PPARS, sabi ko, maganda yung kinalabasan. So, why not continue? Hanggang nakita ko rin na gumaganda yung healing process. Tapos yung WBC, nag-dramatically from 46. Imagine, 46, dramatically bumaba siya ng 39, 33, 27, 19, 15, and then 11, 9, 7. So, nakikita mo talaga yung changes na nagawa ng gamot na yun. So, yung support ng family ay mahalaga sa recover ng pasyente. So, una, yun yung talaga nakikita ko, yung support system. Then secondly, syempre, with the help of the advanced technology, like yung mga ini-introduce ng mga gamot, hindi ko pwedeng alisin yun sa scene, sa scenario. So, ako kasi, dahil nga nasa medical field ako, medyo alam ko yung mga ganyang mga alternative medicine and evidence-based ako. So, sa PPARS, sabi ko nga, maganda yung result. Ito walang harong biro to. It's not joke. Yung man ako binayaran So, it's no joke. Talagang maganda yung yung nangyari sa kapatid ko, lalo na yung wound healing. Yun yung nakikita ko yung wound healing talaga. Nag-granulate siya, gumanda yung circulation, nabuo ng laman, okay? Nagkalaman yung mga paa niya na dating wala. Makikita niyo naman sa picture, di ba? Dating wala, nagkaroon ng laman. So, na-prevent natin yung pagputol. I can say na effective. Okay, effective yung PPARS.
Ano yung ma-advise nyo sa mga patients na same case sa sister ninyo?
Okay. So, I advise them to try. Then, kagaya ko, gusto ko may ebidensya na experience ng on hand ng ate ko. So, ganun din yung papayo ko. Try to experience yung healing, try to take the medicine religiously despite medyo may konting kamahalan, but then kung titignan mo naman yung long-term na gamutan, mas mahal yun. Tsaka hospitalization. At yung, syempre, yung recovery. Yun yung maganda doon yung recovery, mapabilis. So, try ninyo. Hello, I'm Joel Elcano. My sister, diabetic since way back 10 years up to now. Because of Simply Nature, hindi niya na kailangan mag-amputate. Yung recovery niya, yung unti-unti, nagkaroon ng maganda, nagkalaman yung kanyang mga paa. Still recovering, yet nakikita ko yung magandang bunga. And that is because of Simply Nature, PPARS. And I trust Simply Nature.
Assalamualaikum warahmatullahi wabarakatuh. Bismillahirrahmanirrahim. Ako si Haji Norma Yusuf, taga Zamboanga City. Pero dito na ako nakatira sa Maynila. 13 pieces na bukol, pero yung mga iba maliit siya. Pero yung itong isa malaki siya, parang umabot na ata ng 3. Kaya nga ito sabi ng doktor, kailangan tanggalin na. May kaibigan ako, i-try ko daw itong yung PPARS. Pangalawang gabi, may naramdaman ako parang iba. Yung parang may langgam na parang gumagalaw ganyan hanggang dito, hanggang sa talambakan, gano'n. Pangatlong araw ko. Parang kung sumakit yung dito ko, parang gusto ko talaga. Pag ko ganyan sa CR, yun parang lumabas talaga na ganyan, napakarami talaga. Siguro sunod-sunod yun, 3 araw, ganun. Tapos sabi ko, pagtapos yung dito ko, minsan yung parang, ganun-ganun ako. Parang masikip dito, parang minsan sumasakit dito ko, ganyan. Yung na ako dito, umabot na ng mga 5 days, ganyan. Parang nawala yung sakit dito, nawala siya. Parang hindi na ako ganun-ganon. Pag nagsalita ako, parang tuloy-tuloy na, wala na akong halos maramdaman. Kaya siguro, hindi ako, sabi ko, parang ayaw ko magpa-opera. Siguro, mayroon talagang gamot para dito. Binigay ng God. Ngayon, hanggang ngayon, parang maganda ang, maganda ang pakiramdam ko. Yung high blood ko, pag parang magandang tinanggal ko na yung sa cholesterol ko, hindi na ako, pero yung sa cholesterol ko, pag tinatanggal ko yon, parang hindi, mga 2 araw, parang masama ang pakiramdam ko. Pero ito, 14 days na, ngayon 14 days na, basta 2 weeks na, hindi ako uminom ng subastatin, wala akong nararamdaman na parang maganda ang Kaya yun, ngayon bumili pa ako ulit ng tablet. Oo. Kasi sabi ko para para lumakas talaga sa akin Kasi nararamdaman ko talaga na maganda. At Norma Yusuf, ay bukol ako dito sa liig ko, 13 piraso. Umabot na ng 3 cm. Take ako ng PPARS 2 times, morning at saka gabi. Pag numulok ako, hindi ko na siya mararamdaman. At saka, tinakapa ko siya, parang nawawala, parang wala na, hindi ko mahawakan. Hindi katulad ng dati. Salamat, Simply Nature.
Hi everyone, Shyan here. I'm very excited to announce our very first face-to-face in-person meeting for 2025. Freedom from Cancer, we will be exploring the latest strategies on fighting cancer, and there will be a live panel with the leading experts. You're going to have exclusive access to get straight answers to your cancer questions. On the panel will be myself to answer any questions you may have about the Simply Nature PPARS protocol. We have Dr. Jimmy Katapia, one of the top surgeons in Metro Manila, who will answer all your questions about surgery. Last but certainly not least is Dr. Jansen the top specialist in supporting cancer treatments. All 3 of us will be there answering your questions together. So no more confusion, no more conflicting answers. You will get clarity on June 7th, Saturday, 8 a.m. to 11 a.m. SMX Aura. And also there will be cancer survivors who will be there to share their story and how they succeeded in fighting cancer. So once again, see you all June 7th, SMX Aura, 8 a.m.
Sheila, and welcome to another enlightening episode of Simply Healed webinar. This program is proudly brought to you by the collaborative efforts of Simply Nature International and Simply Healed Medical Group. Simply Nature is an international distributor of food supplements made from a unique strain of high-grade microalgae known as PPARS. Backed by scientific research, PPARS have known remarkable benefits in supporting cancer treatment, enhancing general health, and help to reverse metabolic conditions like hypertension, diabetes, and high cholesterol. To quickly recap last week's webinar, we tackled a powerful topic: support and protect your kidneys. It was an informative session with plenty of great questions well addressed by our experts. And this week, we turn our focus on a deeply important theme because tonight's topic is entitled Stay Strong Through Conventional Treatments. We understand that treatments like chemotherapy, radiation, and long-term medication can body. At Simply Nature, our goal is to support you naturally and safely alongside your doctor's plan. In this session, we'll explore nutrition, supplements, mindset practices, and gentle lifestyle adjustments that can make meaningful difference. You'll also hear insights and strategies from our experts to help you stay energized, hopeful, and strong. So, without further ado, let's dive right in. We'll also be having what we call AMA or Ask Me Anything portion session later. So feel free to drop your questions on the comment section. Now, leading tonight's discussion is a successful entrepreneur and a seasoned international speaker who brings deep insight into personal health and success. He is the CEO and founding director of Simply Nature International and PPARS expert from Singapore, Mr. Shyan Lim. We are also thrilled to be joined later by one of the pioneer graduates of St. Dominic College of Asia and a Philippine registered pharmacist since 2018 with more than 7 years of experience in the retail community and clinical setting. Our resident pharmacist and one of the Simply Nature's most dedicated client service officers, Ms Janelle Macanjola. Let's all watch.
Hi everyone, welcome to another episode. When I say oncological protocols, I mean protocols that your oncologist will use to treat your cancer. This includes chemotherapy, immunotherapy, even radiation therapy, and of course, surgery. What I'm going to share with you tonight is usually what I present to doctors, especially oncologists. And over the years, I've been speaking to pediatric oncologists, medical oncologists, and even surgical oncologists. So I'm going to present tonight to you what matters most when an oncologist treats you for your cancer. Okay, don't worry, I won't actually present the super technical presentation that I normally present to oncologists. Instead, I'll do it a bit more layman term and we'll make it like more brisk, more general so that it's easy for you to understand. What's important from today's discussion is that you take away a clear understanding of how Simply Nature PPARS works together with your chemotherapy, with your immunotherapy, and even your radiation and surgery to fight your cancer. Okay, those of you who are going to go for chemotherapy and those of you who are in the midst of your chemotherapy and immunotherapy treatments, even radiation therapy, one of the key things that the oncologist will monitor for you is your red blood cell count. The reason is because almost all chemotherapy drugs have the side effect of myelosuppression. Now, that's just a medical term for the suppression of your bone marrow in its ability to produce blood, right? And when we talk about blood, we are talking about both the red blood cells and the white blood cells. In general, most people understand that white blood cells are part of the immune system, right? But actually, not just the white blood cell. The red blood cell is also an important component of the immune system. Now, when you are undergoing chemotherapy, and those of you who are undergoing chemotherapy now, you will notice you're constantly monitoring your RBC count, your red blood cell count. And the moment your red blood cell count drops below a certain level, you cannot continue with your chemotherapy or your immunotherapy or your targeted therapy or radiation, or for that matter, even surgery. So it's so critical. That's like the one benchmark your oncologist will be looking at and monitoring throughout your journey, through your different cycles of chemotherapy. So today, I'm going to talk about how Simply Nature PPAR plays an important role in monitoring and maintaining this key component, which is your red blood cell count. What happens when you take chemotherapy? We all, in general, know that chemotherapy damages the healthy cells. Specifically, we're actually very worried about the chemotherapy or cytotoxicity, which is toxicity from the chemotherapy, damaging your bone marrow, and specifically in your bone marrow, affecting the way your bone marrow stem cells mature into red blood cells and white blood cells. Okay, your blood is actually produced in your bone marrow, and it starts in there as a blood stem cell. And from there, it will mature into a red blood cell or a white blood cell. So when you undergo chemotherapy, number one, your bone marrow cells actually get damaged. So you can imagine the factory of your blood gets damaged. So of course, your red blood cell starts to drop. The other thing is that your red blood cells themselves can be destroyed by the effects of chemotherapy. Now, let's dive into how chemotherapy actually works to kill your cancer cells. One of the key ways chemotherapy drugs kill your cancer cells is to affect the mitochondrial pathways in your cancer cells. Okay, what are mitochondrial pathways? Okay, mitochondrials are basically the battery or the energy or the generator of every cell. So can you imagine if you manage to knock out or remove the battery from your cancer cell? What happens to the cancer cell? It will stop moving, it will stop growing, it will stop living because it's running out of energy. It cannot produce energy. So most chemotherapy drugs, in one mechanism or another, through different approaches, will try to damage the mitochondria of the cancer cell, and that way kill the cancer cell. So that's how it works. What happens with Simply Nature PPARS is that Simply Nature PPARS extracts will actually protect, I say again, it will actually protect and preserve the mitochondrial functions of your healthy cells. So as I mentioned, the chemotherapy drug damages mitochondrial function. So it will also damage the mitochondrial functions of your healthy cells, specifically your bone marrow cells and your red blood and your blood cells. So that will end up killing and damaging your blood production, right? And then your RBC count drops. And the moment your RBC count drops, what happens? Your oncologist will then be a bit more, will be very concerned because you might not be able to go for your next cycle of treatment. And once your cycle of treatment is interrupted, guess what happens? Your schedule gets delayed. Right? And timing is very important. Time is of the essence when we're fighting cancer. You don't want to delay any treatment. It'll be ideal if you can stick to the original planned cycles that your onco has for you. So while you're undergoing chemotherapy, you should be taking supplements, you should be taking measures to keep yourself healthy, keep your RBC count so that you can go through it smoothly. Okay? So what does Simply Nature PPAR do? It actually protects the mitochondrial and preserves the mitochondrial function of your healthy cells. So because it does that, the main side effect that you get from chemotherapy that everybody's so afraid of is actually mitigated or reduced. Okay. So now, of course, when I present to oncologists that we can protect the cells from mitochondrial damage, the first question that they will come to their mind is, will this also protect the cancer cell, right? Many times when we take any supplements that is like cell food or energizes the cell, one common question that many people will ask is that, will this also make the cancer cell stronger? If I make the healthy cells stronger, then will I also make the cancer cells stronger? So there are a few, I guess, solutions to this or answers to this. Some people will give you a very simple answer, which is like, there are more healthy cells in your body than cancer cells. So it's okay to feed your cells and make them strong because you have more healthy cells than cancer cells. So even though you feed the cancer cells, you also feed the healthy cells. And since the healthy cells are more, it's okay. Well, that's not how Simply Nature PPARS works. Okay, when Simply Nature PPAR extracts protect the cells from mitochondrial damage, it only protects the healthy cells. Yep, you heard me right, and that's where the oncologists feel more comfortable. So what is the mechanism? What's the mechanism? Okay, when the Simply Nature PPAR extract interacts with your cells, the cells need to have a functioning mitochondrial pathway, a normal mitochondrial pathway. Well, cancer cells do not have normal functioning mitochondrial pathways. Just like cancer cells, the shape of cancer cells are different from healthy normal cells. Their mitochondrial pathways are also, how shall we say, compromised, dysfunctional, mutated. Because their mitochondrial pathways are mutated, they don't react with Simply Nature PPAR extracts to create that protective effect. Okay? So in this way, Simply Nature PPARS is able to target only the healthy cells, is able to help only the healthy cells and not protect the cancer cells. So this means that your chemotherapy, your immunotherapy will work 100% fully and not be affected by the protective nature of Simply Nature PPAR extracts on the healthy cells. So this is the mechanism of how the product actually differentiates between cancer cells and healthy cells. And I hope that makes you comfortable to know that your chemotherapy session, your targeted chemotherapy will not be affected by the protective effect of Simply Nature PPARS, but your body will actually be, your healthy cells will be protected. Okay, now let's still stay on the topic of red blood cell count. So now that we protect the existing red blood cell count, this will prevent your red blood cells from dying and of course the count from dropping. But there's another way to maintain and increase your red blood cell count, right? So the other way is actually the production of red blood cell count. So number one, since we protect the bone marrow cells from cytotoxicity damage, that means the factory for making blood is protected. The actual development of your red blood cells is also enhanced. How? Simply Nature PPAR affects cell delineation. It basically, that's a big word, but really what it means is that it helps with the development of your cells. So when your blood stem cell needs to develop into red blood cells, it will develop correctly and you will have a higher harvest, right? Like when you throw seeds in the soil, not every seed will grow into a plant, right? Most do, but not all will. So depending on the fertilizer that you put to help the seeds germinate and grow fruits, right? So your harvest will be different. Simply Nature PPARS will actually improve, all right, the harvest of the amount of red blood cells and white blood cells that will come from your blood stem cells. Okay? I think that analogy will help you understand. To all the patients who are undergoing chemotherapy, your doctor is going to monitor your RBC. So we now know that you can protect the factory for your blood cells, the bone marrow. It also protects the existing blood cells. Number two, it will help with the development of your blood cells, blood stem cells to become red blood cells and white blood cells. And that will increase the harvest of your RBCs. So having these two actions work together will help you maintain, all right, your RBC count. And again, that is critical for your successful keeping to your schedule for your chemotherapy cycles. And that will definitely improve your oncological protocols and give you a better success rate. On top of that, definitely Simply Nature extracts will nourish your body tremendously. So there are many case studies and examples. Most of our patients, especially the ones who are so tired and damaged from chemotherapy and cancer that, for example, they are bedridden, with the Simply Nature PPAR liquid extract, as fast as 72 hours to a week. From bedridden, they will be able to sit up and maybe even walk with assistance. So there's that other benefit, that physical benefit, that the feeling, the fatigue, the appetite, all this we Simply Nature PPAR extracts will help you through your chemotherapy sessions. Okay, of course, some people will talk about hair loss. Okay, you will still shave your head, not because your hair drops, because the doctor will be worried in case your hair drops, you might feel emotionally attached. So they will just shave just so that you won't notice if there's any hair loss. But the good news is Simply Nature PPAR will help you with the regrowing of your hair, right? Because it increases the harvest of cells that are developing. Okay? In summary, how does Simply Nature PPARS improve or enhance your chemotherapy or immunotherapy, even your radiation therapy and surgery? It protects you from the damage of the drugs, the cytotoxicity. It protects the bone marrow. It helps the bone marrow to have a better harvest of red blood cells. So the most important thing that you need to monitor through the treatment, which is your RBC count, stays constant. It will also strengthen your body, right? Give you that strength, increase your appetite, so that you will not be fatigued as well. And all that is very important in that process. And last but not least, for those of you who have already started your chemotherapy and your RBC count is down, and your doctor says we can't continue with the treatment, we have to wait until your RBC count goes up, and you are worried, what can you do? You don't know, your treatment can't proceed, and you are kind of stuck in your fight against cancer. Well, here's the good news. Use the Simply Nature PPAR liquid. That will quickly boost your RBC count up. You know, I personally have had clients and patients that were doing novel chemotherapy drug treatment, and one of the major side effects is that it damages the bone marrow cells, and of course it drops the red blood cell count. Well, the moment they are on Simply Nature liquid, as quickly as 48 hours, their red blood cell count starts to stabilize and then go back up, and they become able to carry on with their chemotherapy treatment. Of course, this would vary from patient to patient, from one cancer type to another, but it will work for all cancer types. But of course, there are variants between the different types of chemotherapy drugs and the efficacy. All right. So for that, you simply just ask me questions in the next segment, which is the Ask Me Anything segment. So I hope this helps all the patients out there who are undergoing chemotherapy, immunotherapy, radiation, and surgical procedures. See you at the AMA.
Good evening once again, everyone. Sir Shyan, I'm so sure that you have picked up valuable insights from this talk and have questions in mind already. Well, good news, because we are now in the AMA or Ask Me Anything portion of the webinar. But before we dive right in, I'd like to take a moment to warmly welcome our viewers for tonight. Now, at this point, all right, we have here, Ms. Ritz Melendez, Ms. We also have Ms. Nena Prisca and Mr. Earl Halos and JR Kamingawa. Yes, hello. Thank you so much for watching us tonight. Now, stay tuned, because if you have questions in mind, you can definitely just write those down on the comment section, right? And we'll try our best to answer your questions tonight. So let's not keep you waiting any longer. I can see some questions are starting to come in. So to help us answer our questions for tonight, let's call once again our resident pharmacist and one of our Simply Nature's most dedicated client service officers, Ms. Jhen Macanjola. Hi, Ms. Jhen.
Hello today, everyone. First of all, I'm sorry to disappoint. Well, Doc Jansen is attending an event, and hopefully he can share his learnings next webinar, while Sir Shyan is currently in Singapore. So I'll try my best to answer your questions.
Thank
Our
you.
topic for tonight is about how to stay strong through conventional cancer treatments. And if you or someone you love is currently undergoing either chemotherapy, radiation, or preparing for surgery, please know that you are not alone. Cancer treatment can feel overwhelming, yes. And as a pharmacist, I've worked with many patients who struggle with side effects, multiple medications, and just feeling weak or uncertain. But we are here, Simply Nature, to tell you that there are safe and evidence-based ways to support your body and make your treatment more manageable. So let's start with the questions.
All right. Thank you, Ms. Chen. Well, for the first question, coming from Ms. Ritz Balendez, if that's the effect of chemotherapy, why is it still being prescribed?
You have a point there. That's a very important and honest question. So it's still prescribed because chemotherapy can still save lives. Cancer is more dangerous than chemo. If it's left untreated, many cancers grow rapidly, invade organs, and then results to metastasis, then became fatal. So chemo is aggressive because it has to fight something even more aggressive. Okay. Chemotherapy drugs work by killing cells that divide quickly. So that includes cancer, but it also affects, yes, our hair. That's why. And then the skin, the gut, and the bone marrow, which causes the side effects of low blood count. That's true. But there's still studies that chemotherapy improves the survival rate and reduce the recurrence risk and can even cure cancers completely, like certain leukemia or lymphoma. And no, mom, that cancer without treatment can really progress rapidly. It depends on the cancer. So the decision to prescribe chemo is always based on the type and the stage of your cancer, then the patient's overall health, like the age, the kidney or liver status. So there's always risk and versus benefit assessment that only doctors can recommend. That's why it's here in Simply Nature, we still say that you should coordinate with your doctors. So we have an upcoming SMX event. You will have there Dr. Jimmy Katapia. He is a surgical oncologist. He does the surgery and can also prescribe chemotherapy. So I hope to see you there, ma'am.
Thank you, Ms. Jen. Yeah, this is actually a very valid question coming from a viewer. And I'm sure, no, a lot of them just right after the diagnosis, and when a doctor suggests to go further into the laboratories or other scans, they tend to, hold back a little bit. But this is how important it is to really go through further with your test so that we understand also what kind of chemotherapy will be given to you. Okay.
Yes, let me just add on that. We always say that there's always new scientific innovations. So now in the modern time oncology, it's not just you should suffer through it. So today's treatment already include we have the pre-chemo meds. So that includes the ondansetrons to reduce your nausea, to reduce your allergic reactions and fatigue. And then we also have the blood boosters to support your blood marrow and produce the white cells and platelets, ganyan. And specifically, we also have natural adjuvants like Simply Nature PPARS, so that supports your cell recovery and immunity. And the newest specialty, which is the lifestyle medicine. So that includes the integrative care, that includes nutrition, supplements, emotional support, holistic support. And I would like to also highlight Doc Jansen Kalalan. So he is an integrative oncologist and a lifestyle medicine specialist. He will also be there as a keynote speaker on that SMX event. So now you don't have to choose between chemo or wellness. You aim for chemo with support so the body can stay strong and finish the fight.
Exactly. Couldn't agree more. Now, for those of you who wish to have a consult with Doc Jansen Kalala, please just simply type in how to consult. Our caring HTS, our healthcare specialist, Miss Beth and Miss Irish, will definitely get in touch with you individually. All right, so for our next question, Miss Jen, okay, coming from Mr. Nesty, thrown to us privately on the messenger, are PPARS capsules enough for benign cysts in my throat?
Sorry, ma'am, benign cyst and?
Benign cyst in my throat.
In my throat. Okay. Yes. So PPARS capsule are usually recommended and other kinds of tumor. And yeah, so we have multiple success stories in our YouTube. Okay, and then we also have benign vocal cyst. Okay, we also have other thyroid tumors. So please connect with your to know more about it. But because more importantly, the dosage depends on the severity of your condition. So PPARS capsule can be taken once, twice, actually up to even 8 times a day. So don't worry about any overdose or side effects.
Okay. Well, reason why we really appreciate our clients and patients who do express their budget concerns, because we do have a lot of different forms of PPARs, like the liquid, powder, and capsules, and also the tablets which we give out, because of course not only that we are considering your health conditions but also your budget, and part of the PPAR protocol success is the sustenance of it. So please get in touch with us. Please understand if we ask a lot of questions to you so that we would understand also, and help us better to give you the best recommendations in terms of the PPAR protocol. Okay. All right, so for our next questions, okay, can PPARs help with cases like elevated PSA?
Yes. So actually, we also have synthetic PPARs. Okay, and they are already prescribed for the prostate problems. Okay, so I actually have a personal client. Since it's elevated PSA is usually just as sign of benign, that's benign prostate hyperplasia or BPH, and then the wife is buying for the husband the PPARS capsule. So that's another evidence of PPARS capsule for benign cases. Okay. And then they didn't use any conventional treatments. They didn't intake any synthetic medicines because they want to proceed with it naturally. And fortunately, there are very big improvements in his PSA level. So that's prostate antigen. That is a blood test. Okay, so you can see that there's really results clinically. Yeah.
Miss Jen, just a follow-up question. Okay, for this PSA, this is just usually in terms of how to test it. It's just blood tests, correct?
Yes, so that's just a blood test.
I see. So it's both, well, applicable, of course, no, for those who have worries if they have prostate enlargements as well. Okay.
Yes, and PPARS also has a potent anti-inflammatory. And another symptom of elevated PSA is like there's a blockage because it have grown bigger, diba? So there's a blockage, and based on her feedback that after taking the PPARS capsule, there is relief during the urination.
Yeah, it's quite common for the prostate issue patients to, urinate a lot more or frequency during at night. So PPARs can definitely help. Okay. All right. So for our next question, all right, can PPARs help? Okay. Can PPARs replace chemotherapy? If we are going to consider PPARs alone, how long would we see the effect?
We've always answered that here in Simply Healed webinar that it really depends on the stage and the severity of your condition, especially if it's already advanced stage 3 or stage 4. We're running against time, so we need more aggressive approaches. That's why if it's still applicable, we still recommend that you go for surgery. If your body can still take it, we still recommend that you go for chemo, and PPARS will be there to support your body. Sorry, what's the other question?
Which is a second. Let me just get back to that question. Okay. How long would we see the effect if we are going to consider PPARs alone?
Okay. Mm, mm. The difference between the before and after is highlighted if the before case is severe. And that's mostly observed during while using PPARS liquid. So we have patients that already can feel physical manifestations after 3 days. So that's 3 vials pa lang. And then they already feel higher energy levels. They feel higher appetite and just relief, like less pain, okay, and more. So but if you, okay, this is ano naman,
Case to case
oo.
basis for patient as
Yun.
well.
So I was saying that if you're generally healthy naman, PPARS, there's no need for PPARS to repair anything. It will just give you a boost, an immunity boost and a nutritional supplement. Ganun. And for if malignant cases, for PPARS, we usually recommend to follow your protocol, stay on the same protocol within 3 to 6 months before lowering the dosage.
Yeah, I just want to quickly add, it really would depend on the severity of the condition, whether it's like an early stage cancer, or if the first time we get to talk to the patient, it's already at the elevated staging, like stage 3 and stage 4. So if a patient is really hesitant to go through the conventional treatment, then we do encourage the patient to be on the highest concentrated form, which is the liquid, because it is most needed since we are not considering any other help in a way, no. But if you'll notice, when we ask questions to our patients, we tend to, incorporate even the diet recommendations so that we could get the highest possible positive outcome as well. But once again, it really depends as well with the budget of the patient, and we try as much as we can, even in the budget, even in the shipping fee. Shipping fee matters. We tend to understand what's your location, how we can help you better, so your budget won't go to the delivery charge instead of the product, or of the help like PPARS. So there. All right, let's go through the next question. Okay. All right. Can PPARS help to dissolve lumps or cysts? As simple as that, Mom Jen.
Yes, PPARS can. I've already answered this earlier, that we have multiple success stories in YouTube, especially Mom Norma. I think that's the latest. So she had 13 lumps in her throat, and then she is taking PPARS powder. And after taking PPARS, she felt like during the interview in the SMX event, she felt like more relief in her throat, like there's no lump. Before she used to have like ganun. But there is a relief, and then she also observed that even her cholesterol levels went down. So that's another side benefit of PPARS.
Yes, because as you know, we are not PPARS is not really basically a pharmaceutical drug. No, that's very much targeted to specific illnesses. PPARS is a very good anti-inflammatory. That's why, in a way, for those illnesses or issues that is caused by inflammation, PPARS is really able to help. Most especially those, illnesses that causes pain. Oh, PPARS can definitely help in those or manage. All right, so for the next question, coming from Ms. Nena Prisca, is it better to take PPARS than to have chemotherapy for a patient with stage 4 cancer? So another replacement, Ms. Jhen.
Oh, sorry, mom. I just answered this also a while ago, that stage 4 is already an advanced stage of cancer. So we would really recommend that this is an aggressive stage already. So we would really recommend that if if your body can still take it, please go for surgery, because after the surgery, then as Doc Jansen says, the headquarters of the tumor is gone already, and then PPARS can be used to simot the natirang cancer cells. Okay, and then Yeah, and if also if your body can still take chemotherapy, please go for it, ma'am. Don't worry kasi PPARS will be there to support your body talaga. So it helps protect your spleen, it helps protect your bone marrow, so you won't have low blood count. You would continue to finish all the chemotherapy sessions.
All right. Let's try to answer, I guess, one or two more questions before we announce, because we have a lot of announcements, very, very good announcements tonight as well. All right, so for I guess second to the last question for tonight, coming from Miss Astrid, what PPARS product can work for insomnia? Wow.
Okay. As for my personal cases, insomnia is a side effect of breast cancer. Ayun, we have lots of breast cancer patients and they also complain about insomnia. If you have breast cancer, you should treat the root cause, which is the breast cancer, not just the symptom, which is insomnia. So in terms of PPARS naman, we if insomnia only, I could recommend PPARS Plus tablets. It has a lot of vitamins and minerals that can really help with your insomnia. For example, ma'am, our PPARS Plus tablets contain calcium. Okay, it's the reason why we drink milk before we sleep at night because calcium regulates sleep cycle with a sedative effect. Aside from that, PPARS Plus has many, like almost 99 talaga na essential vitamins, minerals, and phytonutrients, including, as a pharmacist, it would be my honor to explain this to you, okay? So, including vitamin B6 and B12. B12 is a unique vitamin because it's not found in plants. Yun po. And we are proud to say that PPARS has vitamin B12. So it helps in the production of hormones, the serotonin and then the melatonin. So melatonin, that's usually a capsule, supplement capsule, usually recommended for controlling your sleep, diba? But yun. Okay. It also helps with the depression, with digestion, wound healing, and bone health, etc. Ganon. Aside from that, PPARS Plus tablets also have magnesium. It's the most powerful relaxation mineral. And lastly, because I don't want to drag this on, it also has potassium. So to maintain your deep sleep, so you won't wake up in the middle of the night. And hopefully that helps with your insomnia. So try it, ma'am.
I love that you actually dug deeper into each of the contents now of our tablets. And we always say that when you take PPARS tablet or PPARS Plus tablet, you actually get more than vitamins, and it's true. And this is incorporated always in your PPARS protocol because it tends to make sure that you get the proper nutrition even though you're in the midst of any illness. So just imagine if your kids are really also taking the tablets just for maintenance, or just for everyday use, for prevention as well. And even our elderlies, right? Who doesn't have that much severe condition, how much nutrition are they are taking within the day with our PPARS tablet. So I hope that you could consider, most especially, you know what, this June is once again enrollment season and kids are about to start off their school year once again. So I hope you could consider this to be taken by your kids. As a mother, I would want my kids to be sure to ensure that their health is always at its best, most especially that we are starting off a new year and they'll be, encountering a lot more people and kids outside our home. Okay. All right. So for our last question for tonight, okay, the question is coming from Miss Andrea. How many PPARS tablets should I take for breast cancer prevention? My mom died because of breast cancer. Sorry to hear this. Okay, Miss Jhen?
First of all, our sincerest condolences, mom. I hope you find comfort and love in this trying time. Okay, so you're asking about prevention lang na family history of breast cancer. And how many PPARS tablet? If for prevention with family cancer, okay, it's total of 15 tablets per day. So please don't be shocked. Our PPARS plus tablets are just small and they're chewable. It's suitable for all ages, from infants to elderly. That's why for adult dose with family history of breast cancer, for prevention, the dose is total of 15 tablets per day. So that's 5. You can divide it into 3 doses, 5 tablets, 30 minutes before meals.
All right. Okay. Well, thank you so much, Miss Jhen. All right. But of course, before I let you go, because I think we were able to answer all our questions for tonight, I'd like to ask for your quick parting message for our viewers for tonight.
Okay, so cancer don't just attack cells. It attacks your strength, your hope, and your sense of control. But knowledge is power. And with the right tools, the right team, your medical specialist, and the right support of your family and friends, you can stay strong, complete your treatment, and take back that power. So I'll see you in June 7, SMX. So it's entitled Freedom from Cancer. And thank you for being here. Stay with us. We have so much more to share tonight. We have Sheila has plenty announcements that I'm sure you'll be happy to help you or your loved one, not just to survive, but to thrive through cancer. Good night.
All right, Ma'am Jen, wait. Let me see if there's just a very quick question that came in. Oh wait. No. It could be answered with Dr. Jansen. Okay. And Mr. Shyan Lim next week. All right. Well, thank you so much once again, Miss Jhen, for answering our questions for tonight. And we look forward to your answers, if in case, Mr. Shyan Lim and also Dr. Jansen next week. All right. So thank you once again for joining us today. Remember that taking action in your cancer journeys is a powerful step towards healing and strength. We hope that you feel empowered to make informed decisions and take control of your path forward. Now, if you or your loved one is battling any type of cancer or any health issue at all, remember, science is evolving and new treatments are emerging all the time. So keep informed and explore all available options. So don't forget to like our Facebook page, Simply Nature International, and Dr. Jansen Calalan's Facebook page, Simply Healed Medical Group, and subscribe to our YouTube channel. This is also to make sure that you get updated with our latest promos and events. Now, elevate your organization's wellness initiatives by partnering with Simply Nature International, your trusted expert in holistic health and nutrition. Whether you're planning a seminar or webinar, Simply Nature delivers science-backed, engaging, and transformative wellness experience that inspire positive lifestyle changes. With a dynamic team of health advocates and access to cutting-edge natural solutions, we tailor each session to align with your organization's or your company's goals and values. Empower your team with the knowledge and tools to live healthier, more vibrant lives, because you're also investing in higher employee engagement. So you can have reduced absenteeism and more energized, focused workforce. Let Simply Nature International help you create a culture of wellness that drives success from inside out your company. Now, listen carefully because I have a question for you. Can biopsy make the cancer spread? Or is your body strong enough to survive the surgery? Well, we are calling all our cancer patients, survivors, and advocates, and yes, even doctors. This is your moment to gear up and reclaim our freedom or your freedom from fear and uncertainty of illnesses. Happening this June 7 at SMX SM Aura here in BGC Taguig at 8 a.m. to 11 a.m. is the face-to-face Simply Nature Health Seminar entitled Freedom from Cancer, Latest Strategies, live panel with leading experts. Our panel of experts is composed of a PPARS expert, lifestyle medicine doctor, integrative doctor, and surgical oncologist. Take advantage of the face-to-face AMA portion where you can ask our doctors live during the event. Yes, in the flesh. Now, tickets for face-to-face and Zoom setup are now available. You can also buy your tickets online through our website. Guys, tickets are running low. Attendance is ramping up, so please get in touch with us immediately if you're interested to attend this face-to-face seminar. So what are you waiting for? Buy your tickets to this exciting event now. Now, you are in for a treat because we have an exciting lineup of promos exclusive for direct and website orders only. Because if you buy a box of PPARS liquid extract, you will get a free PPARS tablet bottle, which is worth 1,950. But if you buy PPARS powder extract or a jar of PPARS powder extract, you'll get 5 sachets of Cleansing Plus worth 800 pesos. And another exciting one, if you buy 3 individual packs of soft gel capsules, you will get an extra pack for free. Wow, that is worth 3,700 worth of free PPARS products. It's like buying 3 packs, but you're getting 4, right? So amazing, because please understand that this promos is only up until May 31, which is that is this coming Saturday. So please hurry. Okay, but wait, there's more. Due to insistent demand, we are having another round of 3-day free shipping, because if you buy a minimum of 3,700 via website, that's www.simplynature.ph, you are actually getting the free shipping promo. So once again, this promo is running from May 28 to May 30, up until tomorrow only, Friday. Okay, so experience the benefits of PPARS at an unbeatable price. Now is always the best time to get the best health, not only for yourself, but for your whole family. So experience the benefits of PPARS now. Okay. All right, well, another exciting event, of course, happening once again, the Simply Healed webinar on
Hi everyone,
June
welcome to another
Thursday.
episode.
That is once again, same day, same time, Thursday night at 7:30. Please watch out for the announcement of the title of this webinar happening next week. So thank you so much once again for spending your time with us. Your commitment to healing inspires us. And remember, every step you take is a step forward, and you don't have to walk this journey alone. This is once again Simply Healed webinar powered by SMG and SNI, because your curiosity about your health conditions and victories over cancer and metabolic illnesses are what keeps us going. Because here in Simply Nature, we are always with you from start to healing. Thank you, everybody. Good night, and God bless you all.
Hi everyone, Shyan here. I'm very excited to announce our very first face-to-face in-person meeting for 2025. Freedom from Cancer. We will be exploring the latest strategies on fighting cancer, and there will be a live panel with the leading experts. You're going to have exclusive access to get straight answers to your cancer questions. On the panel will be myself to answer any questions you may have about the Simply Nature PPAR protocol. We have Dr. Jimmy Katapia, one of the top surgeons in Metro Manila, who will answer all your questions about surgery. Last but certainly not least is Dr. Jansen the top specialist in supporting cancer treatments. All 3 of us will be there answering your questions together. So no more confusion, no more conflicting answers. You will get clarity on June 7th, Saturday, 8 a.m. to 11 a.m. SMX Aura. And also there will be cancer survivors who will be there to share their story and how they succeeded in fighting cancer. So once again, see you all June 7th at SMX Aura.